Hello, my name is Sam Feltham. I'm the Director of the Public Health Collaboration and welcome to the PHC Virtual Conference 2020. The coronavirus has changed all of our lives, but where there's an obstacle, there's also an opportunity. And that opportunity comes in the guise of this virtual conference. Earlier this year, we had to postpone our two main events, the annual conference and the Real Food Rocks Festival, until next year. These events allow us to connect, learn and grow, but they also help us raise crucial funds for the PHC to continue. With that in mind, and before we let the next presenter speak, this virtual conference is 100% free for all. But if you find the content valuable today, then please consider donating £2 or whatever you can afford through the Total Giving website via www.phcuk.org/donate. Or if you're in the UK, you can simply text PHC to 70660 to donate £2 directly from your phone. We hope you enjoy the conference from wherever you are in the world, and be sure to get involved in the civil conversation on the comment section here on YouTube or via the hashtag PHCVCon2020 on Twitter, Facebook and Instagram. Thanks for your support, take care and stay safe.
Hello to you all. It's an absolute pleasure to be with you at the Public Health Collaboration Virtual Conference 2020. I'm Campbell Murdoch. I'm a GP. My special interest is in metabolic health, and I also have an interest in quality improvement that we're going to be learning a bit more about through this presentation. The title of the presentation is Breaking You: How to Ruin Your Metabolic Health. This talk was partly inspired by the Nike quest to break the 2-hour marathon barrier, known as Breaking 2. Just like running a sub 2-hour marathon requires numerous actions to achieve that goal, breaking your metabolic health, or breaking you, takes a similar approach. So what we're going to be talking about today is the Model for Improvement, which is a quality improvement tool. We'll talk through the framework for success, your needs and goals, measuring metabolic health and homeostasis. Then we'll look at diseases that shouldn't exist, and then we'll look at in depth of how to break your metabolic health. So to start, we have the Model for Improvement, as I said, a quality improvement tool. The Model for Improvement is quite a simple framework, but it's extremely effective in helping you to reach your goals. Briefly, it comprises of, at the top there, you will see what are we trying to accomplish, what's your goal, what's your aim, how will we know a change is an improvement, so what are you measuring, how do you know if you're doing something you're on track to achieving your goal. Then you think about what change can you make that will lead to an improvement, will result in an improvement, so what actions can you actually take that you think will move you towards your goal. And then at the bottom there, you see the Plan, Do, Study, Act cycle. So this is a cycle that takes you through the various phases needed to put an action into place and then understand the outcome of your action. Next, we have the framework for success. So this is a model I use with all my patients now, certainly when we're thinking about metabolic health. And if we cover these 4 areas for an individual, then the chances are they will reach their metabolic health goals. So first of all, in the top left there, you have somebody's needs and goals. Where are they? Where do they want to get to? And what needs do they have? Top right, you have their individual biology and physiology. Obviously, there are many similarities that we all share, but equally, we may have some individual biology and physiology that will help guide the actions we need to take. Bottom left, as we all know, there's more than one way to achieve most goals, and that's the same with metabolic health. So we need to think about an individual's preferences, their options, and the various choices they have. And then finally, and possibly the most important for many people, is how do we support the journey? It's very well knowing goals, understanding your physiology, picking some choices, but how do you actually support somebody on the journey to address their metabolic health with all the other challenges and often the psychology and psychological challenges that life throws at us. So first of all, we're going to look at our needs and goals and relate this to the Model for Improvement. So as you see there, we're starting with what are we trying to accomplish? Now, with the title of this presentation being Breaking You, How to Ruin Your Metabolic Health, we need an aim that fits with that. So I've picked an aim here. The aim is we're going to ruin metabolic health within the next 3 months. So quite a clear aim there, which is time bound. Next, we move on to thinking about individual biology and physiology, and this relates to, in the model for improvement, how will we know a change is an improvement? This section is really about measurement. What measures do we have for success? In metabolic health, we have some fairly good measures used in the metabolic syndrome criteria. These are waist circumference, blood pressure, triglycerides, HDL cholesterol, and blood glucose. So if we take an action, we want to be looking at these markers to see what impact our action is having on these markers. Looking into this in a bit more detail of how to breaking metabolic health, what happens and what are the markers of successfully ruining your metabolic health. In the middle there you will see metabolic syndrome, sometimes now being called insulin resistance syndrome, and the diagnostic criteria here are the International Diabetes Federation criteria from 2005. As you'll see, waist circumference there, men greater than or equal to 90 centimetres, or if you're European background, 94 centimetres, and women 80 centimetres. Then, if you have 2 or more of the following: triglycerides of 1.7 or more, HDL cholesterol for men less than 1.03 or women 1.29, blood pressure greater than or equal to 130 for the systolic, so the higher number, and diastolic blood pressure, so the lower number on a blood pressure reading of 85 or more, or if you're already on treatment for your blood pressure. And finally, the 5th criteria, raised fasting glucose, so 5.6 or more. Obviously, if you already have type 2 diabetes or indeed pre-diabetes, you will fit that and extremely likely to fit the criteria for metabolic syndrome. So then just to zoom out again to this whole picture, as you can see there on the left, we have lifestyle risk factors and genetic risk factors. And the lifestyle risk factors are the ones we obviously have more control over. So as is shown there, sort of insults happen to the body, try and challenge metabolic health. If you achieve poor metabolic health, if you break metabolic health, then you are much greater likelihood to get these associated conditions on the right there, which I will briefly list for you. Type 2 diabetes, pre-diabetes, obesity, hypertension, heart disease, stroke, non-alcoholic fatty liver, hyperuricemia, gout, some cancers, not all cancers, but some cancers, dementia, Alzheimer's and vascular will contribute to inflammatory condition, polycystic ovary syndrome, thrombosis, increased risk of blood clotting such as DVTs, chronic kidney disease, and even mental health problems such as depression and anxiety. Next, we're going to frame metabolic health so we have an understanding of how we may break it. And metabolic health, like most of what happens in the body, needs to follow homeostasis. So homeostasis meaning keeping things the same. So the human body is designed, if it gets pushed out in one direction, there are all sorts of mechanisms to try and balance it up and bring back a steady state. As I've written here, a healthy metabolism. With a healthy metabolism, the body is efficient and effective at storing, accessing and burning food and body fuel stores. The body remains in healthy homeostasis. The body can grow, repair, survive, and ideally thrive. So how do you break a human? How do you break metabolic health? This analogy is showing a castle under siege. And I think is a pretty good analogy for how you break the human body. And there's 2 things you need to do to achieve this. One is give prolonged hits or prolonged insults, trying to really challenge homeostasis continually. And the second is prevent repair. So as with a castle under siege, as you'll see, there are numerous missiles coming in. And also you want to make sure you shut off the repair supply lines, the fuel supply lines, everything that's needed to try and keep the castle in good shape. What happens when you basically take this approach for the human body is you develop, as I've shown there, poor metabolic health is the really sort of roots and tree trunk of the problem. And then you see all these branches of diseases and conditions that actually shouldn't exist. Many of these were around in only very, very, very small numbers throughout human history. However, recently they have become commonplace, and certainly in my day-to-day GP work, they probably make up a good 50-60% plus of patients' needs that I'm seeing. And this is a key take-home message, really. I think we don't want to really always consider these diseases totally different things. They are all growing from the same tree trunk of poor metabolic health. So now we've thought about what metabolic health is and had considered how we may start to try and break it with these prolonged insults and preventing repair. We now need to think about what our preferences, options and choices are. So what change could we make that may result in an improvement for the modelling for improvement, or can we ensure that is going to ruin our metabolic health? There's obviously many things that will contribute to this. In this presentation, I've just focused on 4, which is sleep, movement, stress, and nutrition. So, first of all, for sleep, ideally, I think for most people to increase your chances of poor metabolic health, you should aim for less than 6 hours of sleep a night. Some people, they get less than 7, they're probably going to have problems, but I think for the majority of us, definitely aiming for less than 6 is going to up your chances of poor metabolic health. I've given some tips here. Obviously, I wouldn't want to advise anyone on what they should do to ensure they don't sleep, but some suggestions could be look at your phone, stare at a bright screen just before bed or when you're sitting in your bed. Another idea might be having a coffee to get some caffeine in to stimulate you just before bedtime. This could delay sleep. And finally, importantly, setting an alarm. So make sure you're woken up before you would naturally wake up. And because most people sleep for somewhere between sort of 7, 8, maybe up to 9 hours, I would suggest setting the alarm for 2 hours before you think you would naturally wake up. And as you can see there's some references, so there is some good study data behind how effective and useful poor sleep may be for you to make your metabolic health worse. Next, movement. So we often hear about exercise and how it affects our health. So the key take-home message here is really don't move ever. Definitely don't do anything that challenges your muscles. So you don't want to kind of lift anything heavy. Certainly don't walk upstairs. If you're going to sort of do some gardening, make sure you're sort of sitting down and don't lift anything heavy. Don't carry heavy shopping bags, and obviously certainly don't go to the gym or lift any weights. Second point there is don't break up your sedentary time. So if you're sitting, there's some evidence that if you move sort of every hour for a minute or two, it may benefit your metabolic health. So the recommendation is sort of sit for prolonged periods, many hours, and that should help have a detrimental effect on your metabolic health. And then finally, they're thinking about sort of how aerobic activity cardiovascular activity can affect our metabolic health. Really highlight here, don't do anything that is strenuous and challenges your cardiovascular system. And as a good rule of thumb, if it's making you breathe faster, you're probably pushing yourself too hard, and there's a risk that could actually improve your metabolic health. So don't do that. So a couple of simple tips. Obviously, you know yourselves better than me, but some suggestions could be if you could walk or if you could cycle there, then do drive instead. And also, if you're somewhere and there's an escalator and stairs, that make sure you obviously use the escalator and not the stairs. Next, we have stress. Now, the key with stress, and I'm sure many of you are aware of the stressful events that happen in your day, but the key is it needs to be relentless. So we don't want a short burst of stress that kind of makes you more alert, makes you function better, and then you spend some time covering. No, for stress to ruin your metabolic health, ideally you need to make it relentless and continuous. There are a number of ways to make this more likely. One, and I think probably a key one, is trying to spend all your time with people that give you a hard time, really antagonistic relationships. Try to work with people and spend time with people who really don't share goals with you or don't have a common purpose, to make sure you're constantly working at loggerheads with them. Another key one, which I'm sure many people can relate to, and they know it can increase their stress, is if you're already feeling overwhelmed, make sure you search out and take on increasing amounts of responsibility. And finally, and interestingly, and certainly topically for the next slide, is talk to colleagues and others about nutrition. Seems to frequently increase stress levels. So as I said, on to nutrition. Now, as with everything we've spoken about so far, nothing exists in a silo. So everything interacts. So as many of you know, if you want to sleep more poorly, you could probably, if you make yourself more stressed, it may affect your sleep, make you sleep worse. Poor sleep will make you more stressed, make you less likely to want to exercise, for example. So everything can really contribute and come together. However, nutrition, I think, as far as metabolic health goes, is the sledgehammer. This is the real 80-20 rule. This is a place to put 20% of your effort to get 80% outcome. I think if you don't address your nutrition, don't do what's need to be done to break metabolic health and nutrition, the other actions you take may have marginal gains. So this is the biggie. And actually, it may be seen as nutrition is the real Achilles heel of metabolic health. So this is if you target this, chances are you will see some results. And why is this? Why should nutrition be such an Achilles heel? And for a number of reasons, but I think this is an important one. So this slide links back to a point we made earlier on about homeostasis. So this is a body wanting to keep itself in balance, wanting to keep the steady state. And blood glucose is important because the body really does need to try and control blood glucose at a fairly consistent level. And that level is just 5 grams of glucose in the total blood volume, which is about 5 litres. So 5 grams being 1 teaspoon, very, very small amount in your total blood volume. Now, if you were kind of designing a program of how you're going to ruin somebody's metabolic health, you might start to see, actually, this is quite a neat place, because for such a small amount of glucose, we may be able to do things to really, really challenge that homeostasis, really chuck bombs at the castle, and the bombs may not need to be enormous. As is shown here, castle under siege. Let's put blood glucose under siege. Let's give prolonged hits to blood glucose. Now, how might we do that? So first of all, let's think about, glucose is a sugar. So if we deliver sugar and glucose to the system through the mouth, that will move from the gut into the bloodstream, often fairly rapidly. And certainly the more refined it is. So refined carbs meaning basically starch, which is simply glucose molecules joined together. And when we eat that, it very, very, very rapidly breaks back down into glucose. So this is showing to challenge the homeostasis of blood glucose, we need a cannon that fires sugar and refined carbs into the blood. Now, how might we do that? Well, a great example, a great guide to help you on your way with this would be to follow what's known as the Eat Well Guide. And the reason for that is the Eat Well Guide recommends for the average adult the about 250 to 300 grams of glucose per day they should be eating. And importantly, as you'll see there on the left, which is a diagram of the Eat Well Guide, that yellow area is showing potatoes, bread, rice, porridge, I think Weetabix are there, some bagels, pasta. So most of these are fairly refined carbs. So these will break down, this is starch that will break down into glucose very fast when you eat it. And with standard government dietary guidelines, the recommendation has been eat 3 times a day and have some snacks. So as I've shown there, that's perhaps divided up into kind of 80-gram carbohydrate meals. So that's the bombs, 80 grams each. And as we're often told, snack between meals. So keep your blood glucose up. don't give the body a chance to bring that blood glucose down and deal with it. So as I'm showing there, that there's the gun there firing the bullets of about 10 grams each. So that'll come to that kind of recommended amount of glucose you should be eating a day. Really challenging that blood glucose level, that 5 grams being all that you want in your blood. So this is really a castle under siege. Let's give the body a hard time and see what we can do. See if we can break it. That's all very good. So we've understood that there's some sort of fairly obvious actions perhaps that need to be taken to break metabolic health. But as we all know, ideas are nothing without taking action. What we need to do is take some steps. We need to learn what works. Quite often get support. Life is tough. We do get distracted. So we may need to seek support from others. And importantly, actually, make what you want to achieve, make it easy. There's no point choosing things that are going to be very hard to do. You may set out with intentions to break your metabolic health, but if you're distracted and the options you've chosen are hard to come by, it's gonna be harder. So let's try and make it easy. So one way to really make it easy is make sure you do trust the standard government dietary guidelines, because if you do trust them, they're going to be encouraging you to eat that sort of 250-300 grams of carbohydrate spread throughout the day to really keep challenging your blood glucose. And the other thing you can do is there's quite a few charities out there actually who partly fund themselves through the commercial world, and so trust their messaging. It can be quite helpful, and certainly if you're trying to kind of do this undercover and you're not wanting people to know that you're breaking your metabolic health, you can use some of this as a kind of an excuse just to keep the attention off that you may be trying to do something that's going to harm you. As you can see here, this advert, Diabetes UK, the national diabetes charity in the UK, partners with BritVit. With the quote there, "Together we will work to achieve Diabetes UK vision of a world where diabetes can do no harm and help families live healthier and happier everyday lives." And it's showing a very, very happy family and a mother saying, telling her son that she just has a single teaspoon of sugar in her blood, and the bottle of drink there saying, "I have 5 teaspoons of sugar in me. Drink me, I dare you." So the mother can really be reassured that if she drinks that's 5 times more sugar in that bottle than there is in her blood. So that really should help challenge her blood sugar, and they can be a really, really happy family with that. If they thinking actually, is this enough? As you can see there, there's a sandwich and I think a bit of cake, really to make sure that there's nothing left to chance. And I think even we're not really touching on this presentation, but I think there's a tub of margarine there as well. So some processed fats seem to be quite effective at breaking metabolic health as well. So I think they may have got the slogan wrong here, but certainly for people that are aiming to break the metabolic health, these are some really, really useful resources. So maybe get some posters, put them on the wall. Give them to, if you've got kids, give them to the teachers, and they can teach the kids. Although they may have them already, because I think many kids get taught this stuff already. So get to them early. We don't want people waking up later in life to realise that they could have achieved poor metabolic health sooner. Next, make marketing your friend. Obviously, you don't want to be thinking about poor metabolic health every day, and some days you might just want a break. So marketing can be helpful because it can kind of really reassure you that life's good. Don't think about the diseases. Give yourself a break sometime. Many of these processed food products have really done a good job of kind of giving you some light relief, making you feel like the world's good. This food, you can get away with it. And also, actually, if you're worried that somebody might be concerned that you're trying to break your metabolic health, these foods are useful because they kind of portray an image that they're healthy for you. So it might keep other people off your back. Also, as you can see the top left there, once you pop, you can't stop. many of these foods are really good at hijacking your kind of satiety and really preventing you from getting that feeling of fullness, so you can keep going. One of the things in breaking metabolic health is to kind of really overeat these foods, keep that glucose, that hit to homeostasis coming in, and make it fun. I mean, Christmas, great time. Let's tie in kind of really sugary drinks into other fun things, and really help kind of make that association, and with that it will help you keep drinking these sugary drinks. And finally, pay attention to the nutritional information you see on packets, because these have been intentionally designed to portray these foods as healthy. So again, if you really identify foods that are like showing the frosted flakes, so the good amount of refined carbohydrate plus some sugar, and clean green sheet on there, and what you'll find is actually what we call kind of real food, so food that's just has no ingredients in it. It's just a bit of broccoli or a piece of meat doesn't come with these nutritional guidelines. So even recognizing that a food has nutritional traffic light guidelines on it can be quite helpful to know, actually this is probably going to be helpful in breaking your metabolic health. Next, we are social creatures by habit, and also our environment matters. It really does. Making choices easy is all about what's around us on our environment. There may be some times when you just weren't thinking about, for example, eating a donut, and you were giving your blood sugar a break. And the problem with that is, if you are trying to break your metabolic health, you don't want to be doing that. You need to be getting that 250-300 grams of processed carbs and sugar into your system kind of throughout the day, ideally. So thankfully, showing here, many of our hospitals now are providing that environment that can really trigger your thoughts of eating more of these foods, and tying that, as you can see here, into sort of staff health and well-being. And obviously, this fits in with the marketing. The more we can do, hospitals can market on behalf of the processed food industry, the better, because that's going to portray an image of this is what we should be doing. We should really be aiming for poor metabolic health, and you can trust hospitals because they're here for all of us. Comment at the bottom there: if someone else is concerned, then just tell them it's a bit of treat and a bit of fun. So occasionally you may come across people who have an interest in actually improving metabolic health rather than breaking metabolic health, and you may find that they give you a hard time if they see you eating donuts for breakfast. Don't worry, if you see them, just have a stock phrase ready, like tell them not to worry. It's just a treat and a bit of fun, and they don't need to worry about you. You don't normally do this, and we don't normally have donuts piled up in the hospital. Work out a stock phrase that works for you, so you're not caught on the spot and don't know what to say. But you do need to. Everyone is different in the world and does have different opinions. So make sure you know your goal, and you can defend it. So coming back to now, the framework for success is really putting together what we spoke about. So we talked about our needs and goals. Let's break metabolic health within 3 months. We talked about individual biology and physiology and the markers we have, the measures to make sure we know we're on track. We've thought about preferences, options and choices. We talked about sleep. We talked about movement. We talked about stress, and we spent a bit more time thinking about nutrition. And then we looked at how we can really make our choices easy and make them the default options. And really this puts it all together. So breaking you how to ruin your metabolic health. So as you can see there, you implement those lifestyle risk factors, and I hope you take some of the tips I've shared today. Speak to your colleagues and see if you can create the sort of environment that supports you in taking these actions. That will drive insulin resistance, and you can use these measures to show that you're your metabolic health is failing, you're developing insulin resistance. So you should notice your gut growing, so that fat around the middle, sometimes nicknamed the insulin tire. If you get your blood test done, you'll often see triglycerides are coming up, HDL cholesterol may be going down, blood pressure may be going up, and your fasting glucose may be going up. Importantly, not all of these will happen with everyone. This is why you don't need to have all of these markers in the diagnostic criteria to show you insulin resistance. But if you've got 3 of them, there's a fair bet you're doing the right things to break your metabolic health. And with that, you can be confident that you're certainly not going to get all of the associated conditions that you see here, but you can be confident that you really are increasing your risks of getting these and sooner. With all aims, as we said, they're time bound. So driving this system hard, you can probably guarantee you'll get at least one of these, and you won't have to wait until you're 90. And if you're interested, then you can always see a doctor who can start giving you increasing amounts of drugs to treat these, and make sure you don't address the lifestyle risk factors. If you do that, as we'll see in a moment, you can actually start to reverse the process and fix metabolic health, which is, if that's not your aim, you want to stay well away from any actions that are going to stop challenging blood glucose. So, second to last slide here. There may be a few of you that have listened that thought, well, that's all good and well, but actually I'm more interested in fixing metabolic health rather than ruining it. And if you're one of those in the minority that are interested in better metabolic health, I've just left some suggestions here of what you might like to do. So for nutrition, suggest eat real food. So that's stuff that doesn't come with the ingredients list. So avoiding processed food. Try to avoid that sugar and refined carbohydrate. So don't keep challenging your blood sugar. Eat some sort of lots of vegetables, above ground veg. Not too much of the starchy veg. Enjoy the healthy fats, olive oil, and then sort of naturally occurring fats that haven't had to be processed. And enjoy whatever you enjoy with protein. So fish, dairy, meat, eggs, nuts. Some people, if you're vegan, you might like things like tofu. So that sort of stuff isn't going to give your body too much of a hard time, and it may support it. Sleep appears most adults, as I said earlier on, about 7 to 9 hours. So if you're wanting to improve things, aim for about 7 to 9 hours. Physical activity, try to reduce your time sitting. So try to move for 1 to 2 minutes every hour or so. Try to get a bit of cardiovascular exercise in the week where you're a bit out of breath, increase your heart rate, and challenge those big muscles, however you like to do that, a couple of times a week. Lifting heavy, shopping, going to the gym, doing some press-ups, bit of heavy gardening, housework, whatever you like. Stress, finally, take steps to reduce chronic stress. Obviously, I'm not going to tell anyone how to address their stress, but for many people, do try to seek out some sort of meaningful relationships, maybe develop a hobby that you're interested in, that you're in control of, spend a bit of time outside. Things like that can often help many people. So I know this talk was about breaking you, how to ruin your metabolic health, but just in case there was a couple of people listening who were interested in improving the metabolic health, reversing insulin resistance, potentially reversing type 2 diabetes, losing weight from around the middle, feeling better, coming off drugs, these are some ideas that may help. And finally, if you are in that latter group that you want to improve your metabolic health, then the Public Health Collaboration has lots of great resources. And as you can see there, many great people who a fantastically supportive community that can really help you make the right choices to and make improving your metabolic health the easy option. So I hope that's been interesting for you. It's been a real pleasure speaking to you. As always, as I say to all my patients, I love to hear tips, what's worked for you. So whether it's a tip of how to really accelerate the breaking of your metabolic health, or if you're somebody that has or sits in the camp of wanting to improve your metabolic health, tips around that. Everyone's different. Different things do work for different people. So sharing a wide range of tips, top tips from each other, I'm always interested in that. So hopefully see some of you in person next year at the conference next year, but otherwise fantastic to be with you all. and I'm looking forward to enjoying the rest of the conference. Bye-bye.